Services, and I'm joined by Amanda Fuller-Moore, the state's chief pharmacist and head of COVID vaccine operations. Monica McGee and Nicole Fox are our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish interpreters. So today, out of an abundance of caution, the Center for Disease Control and Prevention and the Food and Drug Administration recommended a pause in the use of the Johnson & Johnson COVID-19 vaccine. The recommendation follows 6 reported cases of a rare type of blood clot in individuals after receiving the J&J vaccine. Now, our primary concern is the health and safety of all North Carolinians. Therefore, we are following those recommendations of the FDA and CDC and have asked our vaccinating providers to pause the administration of the J&J COVID-19 vaccine until we learn more. The safety system in place is working as it should. These adverse events appear to be extremely rare. There have been 6 reported cases of this rare blood clot, which was also seen in combination with low levels of blood platelets. This is a very different and rare type of blood clot and needs to be treated differently. Usually, an anticoagulant drug or a blood thinner called heparin is used to treat blood clots. But in this case, administration of heparin may be dangerous, and alternative treatments are needed. All 6 cases occurred among women between the ages of 18 and 48, and symptoms occurred in days 6 to 13 after vaccination. None of the 6 reported cases were here in North Carolina. And as of last night, North Carolina providers had administered 242,000 doses of the J&J vaccine. And it's important to note that the vast majority of people who received the Johnson & Johnson vaccine will only experience the expected temporary reactions, like soreness of an arm or feeling achy or tired for a day or two. That's what I experienced when I got the Johnson & Johnson shot. Mild headaches and flu-like symptoms in the first few days after a vaccination can be expected and are not associated with this more severe concern. And while it is extremely rare that you could have a severe adverse reaction, people who have received the Johnson & Johnson vaccine and who develop severe headache, severe abdominal pain, leg pain, or shortness of breath within 3 weeks of their vaccination should contact their healthcare provider and let them know that you've had the J&J vaccine. Again, today's actions are a result of a vaccine safety system that is working. Our safety monitoring systems are highly sensitive, which is how the CDC could identify such a rare number of events. This pause will allow them to look further at the data and make sure that providers know how to treat this rare blood clot. All vaccines are closely monitored, and you can play a part in that, promoting their safety. Anyone experiencing possible side effects should report them to the Vaccine Adverse Event Reporting System, or VAERS. This national system collects data to look for adverse events that are unexpected or appear to happen more often than expected or have some sort of unusual pattern of occurrence. The CDC is convening a meeting of their Advisory Committee on Immunization Practices to review these cases, and the FDA will review that analysis as it is also investigating these cases. And out of abundance of caution, we will pause the use of the Johnson & Johnson vaccine until that process is complete and further recommendations are provided. So if you have an appointment for Pfizer or Moderna, please go to your vaccine appointment as planned. If you have an appointment for Johnson & Johnson, your appointment will need to be rescheduled. We'll continue to provide everyone with timely and accurate information as we learn more. COVID-19 vaccines remain the most effective way to end this pandemic by preventing the spread of COVID-19, preventing hospitalizations and death. Our goal is that everyone gets a safe vaccine. Everyone 16 and older is eligible right now to get vaccinated. These vaccines are free, and you don't need an ID or insurance. You can learn more about vaccines at yourspot.yourshot.nc.gov. And with that, we will open to your questions.
Our first question today is from Brian Anderson with the Associated Press. Hi, Dr. Cohen. Brian Anderson here with the Associated Press. Thank you for the question. I know you just said that if you have a J&J appointment, you'll need to have it rescheduled, but we know some clinics are saying that you could just come in and get a different shot. Just to be clear, is there enough supply of other vaccines in the state to say anyone should come if they have a J&J appointment and just get a different vaccine? Thank you.
Thanks, Brian. So I have Amanda Fuller-Moore with me, who heads our COVID vaccine operations. But let me start by saying that our providers are making adjustments right now to how they are handling that. Many will need to be rescheduling their appointments. Some will be able to shift over to the different vaccines, the Moderna or the Pfizer. Either way, we want to make sure that our vaccine providers are communicating with everyone clearly so that they know what they're getting when they show up. Let me turn it over to Amanda Fuller-Moore.
Good afternoon. Thank you. So we do anticipate that at this point, based on our current state inventory, we have about 85,000 first doses of the Pfizer and Moderna vaccine available. We're also receiving additional first dose inventories today and tomorrow. We have, as Dr. Cohen said, asked our providers to reach out proactively to vaccine recipients who were scheduled for a Johnson & Johnson vaccine to let them know what their individual options are, if that is to reschedule if they choose to do so, or come in to receive another vaccine. But we do anticipate that we still have vaccine available for anyone that wishes to receive it.